We're ready.
Perfect.
All right. Good evening, everyone. My name is Claudia Gotti from ADHD Online, and thank you so much for joining us tonight, for taking the time to join us with this webinar. I am going to introduce you to our panelists today. We're very excited to introduce you to Dr. Amy Marshall. She is a licensed clinical psychologist in South Dakota. Dr. Marshall works primarily with children and adolescents. In addition to individual and family therapy, she completes psychological assessments for ADHD and Autism spectrum disorder. And we're very excited. She's going to talk about ADHD and Autism spectrum disorder. Further ado, Dr. Marshall, thank you so much for joining us.
Thank you. Thank you for having me. Like Claudia said, I'm a licensed psychologist in South Dakota, joining you today from Sioux Falls, talking about ADHD and autism, that there's a good amount of overlap with the diagnostic criteria for these two things, and a high number of people will meet criteria for both. Sometimes someone who has one or the other, there's some overlap. So just some education today about each of them and the two of them together, and what those assessments kind of look like, what the diagnoses mean, different treatment options, things like that. There is a Q&A option towards the bottom of your screen in Zoom. I have some time set aside at the end. I'll be looking at some of those questions, but you're welcome to shoot them out there just as they come to you. Let's make sure that there we go. So ADHD and autism in the DSM are both categorized as what we call neurodevelopmental disorders. What that means is that there is a difference in someone with ADHD or autism. The way that the brain and the nervous system develop is different than someone who would be what we would call neurotypical, someone who doesn't have a neurodevelopmental disorder. This is different from other mental illnesses. Things like anxiety and depression have to do with chemical differences in your brain versus a difference in the way that the brain grows. So this means that people with a neurodevelopmental issue, that this starts before they're born, kind of as their brain is growing. It also means that this difference is lifelong. It's not something that you kind of grow out of or quote unquote cure. And there are a lot of different theories about why this might happen. Some of it has to do with evolution, that some of these brain differences might have been adaptive a long time ago. There's also just the idea that everyone's brain is one of a kind, and we need everyone to have a different kind of a brain. I tell kids all the time, we need all the different strengths. If everybody only had my strengths, we would starve to death, because I'm not a very good cook and I can't grow plants to save my life. I actually killed a cactus once. So, you know, we need people with different brains and different strengths. You can have one neurodevelopmental disorder, more than one. You can have a neurodevelopmental disorder in addition to a different mental illness like anxiety or depression. Sometimes they kind of go along together, because society is sort of structured to be that most people fit in this box. And someone who's not neurotypical, instead of saying, well, why do we have to have everything be in this box? We kind of just let those people feel like they're maybe less intelligent or not as good at things. So it can often lead to some other mental illnesses. Like I said, neurodevelopmental disorders are lifelong. Adults have them too. But it can look different. Part of that is that when you're an adult, you get a lot more say in what environment you're going to be in. You choose a job based on your own strengths. So if there's a deficit in, say, the school setting, you end up working in a setting that's not bringing that out. So that's why you might see someone looking less like they have the neurodevelopmental issue as they get older. It's still there. It's just a matter of the different environment. It's also a matter of a lot of adults have learned more adaptive kind of skills to be able to have it be maybe less obvious to the people around them. Something I do also want to note is that assessments do tend to be very deficit focused. So that means that if a child meets criteria for ADHD or autism, but is very intelligent, and they're maybe more inattentive type. Their grades are good because the higher IQ is compensating. We focus very much on deficits when we're doing psych evals because people don't really call me to test them because things are going really well. So people go undiagnosed basically if they're not inconvenient for the people around them, which is sometimes why you get people being tested as adults instead of in childhood. So what is ADHD? I am going off of the DSM-5 criteria. Don't worry, I won't read all of this to you, but basically the bullet points are that ADHD previously was attention deficit disorder or attention deficit hyperactive disorder. In the current DSM, the DSM-5, there is ADHD, and you can have inattentive presentation, hyperactive presentation, or combined presentation. The reason for this change was a couple. Well, there were a couple of reasons for this change. One, the treatment protocol for the three types is very similar. And two, a lot of people, I didn't jot down the exact percent, but more than half of people who were being diagnosed with either ADD or ADHD were meeting criteria for both for that combined presentation. So this just sort of streamlined that diagnostic process. And like I said, it can be masked by things like someone who's very intelligent or someone who has ADHD but is also highly anxious. It's kind of like, well, in Sioux Falls, we're having a snowstorm today and the roads are not great. So if you've ever driven in snow and you're like white knuckling it through that drive to get home safely, that doesn't mean that you're necessarily an excellent driver, but your fear in that moment compensated for the roads being bad. So you sometimes get people who mask really well as children. They don't show those symptoms. And hence why there's this idea that ADHD, because it's neurodevelopmental, starts before you're born. But you see this people getting diagnosed in adulthood because it's not identified before then. There is also some debate in the field. Well, this applies to everything in the DSM, but a lot of things are very focused on how much it impacts your functioning. So again, you get, if someone is struggling, but they're not inconvenient to the people around them, they kind of fly under the radar. So that's just something in the field that we're continuing to work on the language and the definitions. So autism spectrum disorder, first, just a little bit of information about using language around these diagnoses. The autism community at large has communicated that their preferred language is to say autistic person instead of the more common person first language, where you might say person with ADHD. The language preferred within the community is autistic person. So that tends to be the language that I use because that's what I've heard from that community. Now, if an individual in my office says, please refer to me as person with autism, you know, I'm not going to tell them that they're wrong, certainly, but in general with these sorts of presentations, I go off of the language that the community has said that they prefer. So autism spectrum disorder, this again is the definition based on the DSM-5. Previously, autism was broken down into pervasive developmental disorder not otherwise specified, Asperger's, and autism. A lot of people still use the term Asperger's, but the DSM-5 combined these three diagnoses. And again, there were a couple of reasons for making the change. The main difference diagnostically between Asperger's and autism was just how old you were when you learned to talk. And there was a lot of inconsistency among psychologists that if I evaluated someone and said, okay, it's Asperger's, not autism, another psychologist would look at the same person, same information, and would say, no, autism. So there just wasn't consistency in diagnosing. There wasn't that very clear distinction that these are two different things that we need to name differently. And that also led to an issue with lack of resources, that someone who had the label of Asperger's would be told, well, this resource is only for autistic people, we're not going to give you access to it. So it became also an accessibility issue in that sense. Again, there is the issue that the diagnostic criteria is based on that functioning, which is very, very hard to tease out because someone could be higher functioning versus lower functioning in different areas. Frankly, could depend just on their stress level at a given time, things like that. Another issue that you run into when evaluating for autism is that a lot of the assessments that we use to test for it go up to age 18. So if someone doesn't get diagnosed before 18, it can be hard to get the diagnosis because a lot of the measures, like I said, the measures that are specific to autism tend to cap out at 18, and the other measures aren't specific to autism. So it's kind of a figuring out best practice with what we have available, but there's just that need in the field to develop adult specific autism assessments. So according to CHAD, which is an organization, not a guy, more than 50% of autistic individuals also have ADHD, and about 25% of people with ADHD are also autistic. So there's a good amount of overlap with the symptoms, and there's a good amount of overlap of what we call comorbidity, that people having both. They're both neurodevelopmental, so they both have to do with how the brain develops. They're not based on the chemicals, how they're working in your brain. They both are lifelong, and they both can cause issues with social and academic functioning. Both autistic individuals and those with ADHD can have trouble with focus, communication, fidgeting, hyperactivity, being very sensitive to sensory things, and then difficulty with executive functioning, which is your brain's ability basically to take information, break it down, break down tasks into individual steps, things like that. So these things might manifest slightly differently with ADHD versus autism, but there's a lot of similarities and a lot of that symptom overlap. And like I said, a good chunk of people will qualify for both. So this is kind of my little graph showing that all the people with ADHD, all the autistic people, and then here's that big overlap, that 50% for autism and 25% for ADHD. So the differences are kind of nuanced, a little bit subtle. First, like I said, both can have issues with attention. For autistic people, the issue will be if it's not a task that's preferred, there's no attention span. But if it is a special interest or a preferred area, there's that hyperfixation and a lot of difficulty stopping that task if we need to do something else, say eat, go to school, things like that. And then people with ADHD, the activities that they prefer tend to be the activities that don't require as much focus. I like to give the example here that a lot of people with ADHD really like video games. And I actually hear from parents quite a bit, well, how can my child have ADHD? They can sit down and they can play a video game for 6 hours. Video games don't actually require attention span because the stimulus is constantly changing. So it really draws the person in, and it really can pull that focus because it's continuously changing colors, sounds, images, things like that. So it's constantly shifting. So it's not that it requires a lot of focus, it's that it's very stimulating. Another area where there's some similarity but also nuance, communication. Autistic individuals might really want to make social connections but struggle with awareness, nonverbal cues, body language, some social kinds of things that might come automatically to a lot of people they might not necessarily notice. With ADHD, there is a lot of trouble with the mental filter. Things are being said without the thinking, do I want to articulate that thought before it comes out? Difficulty with interrupting, butting into conversations, blurting things out, which for kids especially can be challenging because other kids will get annoyed with that. For all neurodevelopmental issues, routines are very important for both autism and ADHD. Routines and boundaries really, really help with getting done the things that need to be done, reaching goals, things like that. And the difference that you see with ADHD and autism is that autistic individuals tend to really like creating these routines and might create a very, very specific routine that becomes very important to them, but might be difficult to stick to and frustrating for other people to try to follow who don't see the same significance. Versus with ADHD, even though the routine is helpful, the ADHD brain doesn't like it. So there's maybe that resistance to following that routine, and those overlaps in those areas can make it hard to get a clear diagnosis. And if someone has kind of both going on at once, it can be hard. You can say, oh no, this is due to the ADHD, and be overlooking an autism diagnosis, or vice versa. So assessments with children and adolescents, so like I said, I primarily work with this population. I do also do assessments for some adults, but it is primarily child adolescent. For both, you're wanting, if you can, to get observational information from parent, teacher, and an observation, my own observations as the evaluator, a detailed diagnostic interview, including information about early development. And then for autism, the ADOS is an in-person assessment that the child does with the evaluator that basically analyzes how they interact socially and how they engage in play, and kind of lines that up with diagnostic criteria for autism. Autism spectrum rating scale is norm referenced ratings. Norm referenced ratings refers to forms that have been developed that tell us, for example, everyone has trouble with focus sometimes, not everyone has ADHD. So this will take these symptoms and will say, is this person showing these symptoms outside of what is just part of being a human? And in what specific ways are they outside of that kind of typical human experience? The ASRS has a parent and a teacher rating for that. And then ADHD specific assessments for children, adolescents. The Connors and the Vanderbilt are both, again, those norm referenced kind of rating scales that look at specific symptoms and how are we falling outside of just the range of typical. And then the test of variable attention, the TOVA, is a computerized test that basically measures your ability to pay attention in real time and sees if you're struggling, and then struggling in a way that's specific to ADHD. For adults, it's kind of similar, doing that diagnostic interview if they've been previously evaluated, looking at previous records. And then the TOVA is normed, I believe, through age something like 84. So never too old to be referred if you're feeling like you could use some support. And then the Connors for children, they also have an adult rating scale, and that one, there is one for an observer, so someone who's very familiar with the person's behavior, and then a self-report. Like I said, the assessments for autism tend to top out at age 18. So if an adult is needing a diagnosis, you again want that interview, that background information, if there's any previous records of any kind of assessment or school records, looking at those. And then kind of looking at different personality measures like the MMPI, the MCMI, and those look at a pretty big range of different symptoms, different mental health diagnoses. And then through that, analyzing, okay, are we seeing symptoms that match up for autism? It is something that, another reason why I really think we need to prioritize creating some of these measures for adults is that a lot of autistic adults will get misdiagnosed with a mood disorder or a personality disorder or something like that, because it's basically just not occurring to us to test for it. And we know that kids with ADHD and autistic kids grow into adults who have ADHD and autistic adults. So we want to, just because someone maybe wasn't tested when they were younger, for whatever reason, we don't want to tell them, oh, I'm sorry, your parents didn't bring you in before you turned 18, so you just never get a diagnosis. Also want to, in these assessments, look at comorbidities for things like depression or anxiety, because a lot of people with a neurodevelopmental issue do develop some amount of depression or anxiety, and that's just to help kind of see the full picture. So as far as treatments, this is generally very individualized to the person. A diagnosis is a label, and a label might apply to an individual, but it's not that that individual is that label, just that that label lets us know what supports might be beneficial for them. For ADHD, there's often a recommended combination of some type of stimulant or non-stimulant medication, and then behavioral and psychotherapy interventions. Basically, there's no one-size-fits-all way to deal with ADHD, but seeing what are this individual's strengths, what environments kind of bring out the best in them, things like that. And then for autism, there's not a specific medication regimen recommended, but there are ways to help the individual if they're saying, hey, I'm not understanding these social situations and I want to be better at making friends. There's social skills kinds of things you can do. For kids, both autistic kids and kids with ADHD, having sort of the kind of the sticker charts, behavior plans to help reinforce preferred behavior. I do always tell parents, you do not want to take away any type of affection or quality time or like family time sort of activity. It's not about punishing behavior away. It's about teaching skills that will help them have their best life and help them be the best that they can be. So it's more about structure and creating that routine. And it's not about, because we don't want to punish a neurodevelopmental disorder. We want to help bring out the unique strengths and to help that child have their best life. And then that, again, like I said, is very personalized to the individual. Both have good outcomes if there's, like I said, for example, with autistic individuals, if they're saying, I do want to work on these social skills, they can learn those skills. They maybe just need a little bit of support and a little bit of help in noticing things that aren't coming automatically just because their brain's working a little bit differently. So deciding to be evaluated is a very personal decision. Some people do choose to hold off on an evaluation for themselves or for their child. And the reasons for that can be that medication does have side effects for ADHD. There is always the chance that it could be considered, I know we're not currently doing pre-existing conditions, but if that were to come back, could be considered a pre-existing condition. Certain diagnoses, the military won't allow you to enlist if you have a history of something, and there is still stigma for mental health, any diagnosis. It has improved somewhat, but it is still there. So there is the possibility of facing stigma for that. Now, if you are diagnosed outside of, for example, if you want to join the Army, they look at all of your records, but you don't have to tell, say, an employer that you have a diagnosis unless you're seeking a specific accommodation. It's your private medical information. And being diagnosed does allow access to diagnosis-specific resources, apparently leads to higher life expectancy. If you are seeking therapy for anxiety, but you also have undiagnosed ADHD or undiagnosed autism, that can help your therapist tailor treatments to how your brain works specifically. It does increase that self-understanding, empowerment, less likely to have comorbid mood disorders if kids are diagnosed younger, lower risk for self-harm, suicidal ideation. And if someone with ADHD wants to seek medication, typically you do have to have that confirmed diagnosis. Now, getting diagnosed doesn't mean you must take medication. That again is a very personal choice. And I have worked with people and I've seen medication do some pretty awesome things. And I've also seen people say it's not for me and they've still made really good progress without it. And I've seen people take medication for a while and then say, okay, I'm going to stop and see how I do, and they do much better. There's not one way to do it because, again, a diagnosis is a label, but it's not a definition. It's to help us bring out the best in the individual. Another thought I like to say about medication is if it makes you feel like a zombie, it's either too much or the wrong one. It's supposed to bring out the best version of you, not change your personality, turn you into someone else. So I will now turn over to questions. Looks like it is there a correlation with learning disabilities as well? Yes. So learning disabilities are also categorized as neurodevelopmental disorders. So there is a higher possibility for learning disability with ADHD or autism, and there is. Sorry, they noted that I answered that. Sorry, but yes. Any ideas to help a child who constantly interrupts or overshares? Yes. So this again is that kind of social skill issue that you do want, to bring out the best in the child, but it's going to be, it is off-putting to be having a conversation with someone who is continuously interrupting. Some of it does depend on the age, but a social skills group can be very helpful for a couple of reasons. One, a child who is participating in a social skills group is practicing those skills in real time. Two, if it's a group that kind of matches kids based on, here's some shared struggles, let's work on them together, they get to real time kind of experience, oh, this is why I need to hold back. This is why this is an issue. And pulling back in that way. There is a book, and it's not here, it's in my office, but it's called My Mouth is a Volcano, that helps talk to kids about that holding back, to not interrupt and to not overshare. That can be really helpful. That would be more for elementary kind of age kids. So, but that is one that I've used in my practice. Gender differences with ADHD and autism. There are gender differences. First, for ADHD, girls and women tend to be more inattentive versus boys and men more hyperactive. Also for autism, girls tend to mask the social skills issues more than boys. Also, on a kind of societal level, the kind of special interest, the hyperfixation with autism with girls tends to be labeled, for example, as, oh yeah, girls just like horses, and she just likes them a lot. So it is more likely to be undiagnosed until adulthood. So yes, there are gender differences there. At what age can ADHD be diagnosed? I believe now assessments for inattention, the Connors that I talked about starts at age 6. But you can screen for some of those inattention kinds of issues younger. I believe the DSM says the very youngest is 4 or 5. But again, that doesn't mean we want to give every 4-year-old Adderall, but just that you can know, okay, there's a brain difference here. Let's help. Let's offer some support in that kind of a way. What is social pragmatic communication disorder? Social pragmatic communication disorder is similar to autism. It's kind of the social skills side of autism versus without as much the sensory sensitivity, the repetitive behaviors and things like that. It's not technically autism spectrum. It is a separate diagnosis in the DSM, but again, it is another neurodevelopmental diagnosis. I would predict that in the future, it might be categorized under an autism umbrella because there is that overlap. There's actually, this is a little bit of a tangent, but sensory processing disorder is kind of that sensory side of autism without so much the social issues. And that one is not actually in the DSM yet. So we're still kind of working on, okay, what are the different ways that this manifests? What are the different things it can look like? How can we help the most people, basically? Share a little bit about sensory challenges with children and ADHD. Sure, so sensory issues refers to basically if someone is experiencing things in a different way than what's typical. And this is something, like I said, you can see this with ADHD, you can see this with autism, and then there is some evidence for a sensory processing disorder specifically that's just not in the DSM yet. But it's basically they are perceiving certain things differently. And the best example I can think of for this is a lot of kids with neurodevelopmental disorders will not wear jeans. And the parents are like, why are they refusing to put jeans on? And I say, imagine if everybody around you was wearing pants made out of sandpaper. And they kept asking you, why don't you want to put on these awesome sandpaper pants? And you're trying to say, I don't like them. Well, with kids, it often gets interpreted as oppositionality because they're saying, I'm not going to wear those pants. And what they mean is, these are uncomfortable. This hurts me. And what we're hearing is, no, I'm not going to do it. So it's it can be helpful to try to find things that are comfortable for them. This can also manifest as texture issues with food, not wanting to eat certain foods, being very sensitive to noises, bright lights, things like that. Advice for an adult seeking a diagnosis. Found it difficult to find a provider that diagnoses adults. Yep. So yes, females do present differently. The good thing that we know that women and men present differently has meant that the training that we get to diagnose is more specific to, it can be more specific to looking at those specific things. ADHD Online does do these ADHD assessments, and you'll have to, I believe the assessments are available in most, if not all, of the United States, that you're able to get that assessment done online. It's generally a psychologist doing that diagnosis and doing that testing. But like I said, never too old to be tested if you feel like you could use some of that support. How young can a child be tested for both? So autism, the Autism Spectrum Rating Scale goes down to age 2. So that is, so autism you can detect a lot younger than ADHD. And then I think we had spoken to ADHD before. If you were previously diagnosed, should you also get tested for autism? If you're previously diagnosed with ADHD, should you also get tested for autism if you're an adult? It's a very personal kind of choice, but if you are looking at the symptoms and you're seeing, and a lot of it is ringing true to you, and you're noticing, you know, this and this meet for ADHD, but these other things are going on that don't really meet with my diagnosis, there's always the option to get tested again. And because of that overlap, there is always the possibility of meeting criteria for both. I hope that answered the question. Should I have my son tested again? He had extensive testing at 10 and he is 13. So like I said, ADHD and autism are both lifelong. So if he was diagnosed at 10, it's not that he would stop having it, but I believe that the recommendation is every 3 years to get new data to see if there's maybe a comorbid diagnosis that's not being addressed. That can also help you to track whatever treatments he's receiving. Is it helping him? In what way is it helping him? What additional supports do we need to add at this point? So typically, I believe you can retest after a year, but it's generally recommended to retest every few years. I know that school IEPs redo the testing every 3 years just to see, again, where are we at now? Are we improving? What else do we need? What do you think is the biggest roadblock for achieving higher rates of identification, not letting kids slip through the cracks for autism and ADHD? I think that one of the issues here is that, like I said, these are so deficit focused, and for kids especially, if a child is not inconveniencing the adults taking care of them, that child is not getting referred. So I think we tend to assume that everybody is neurotypical until proven otherwise. So I wonder if changing the language around it to say, look for these things, maybe your child could use some support, even if they're not making behavioral waves, to still be able to offer support that way. Another thing I think would be helpful is focusing more on teaching kids how to talk about their internal experiences. Some adults that I have diagnosed said, I just thought everybody felt this way, and I was the only one who was showing it, because we don't really talk to kids and help them consider these things to begin with. So they're not able to say, oh, you know, something's wrong. They just think this is what being human is. Is it common that stuttering can be common with ADHD? Yes, especially with ADHD and kind of the no filter and the blurting, kind of brain going too fast for the mouth is my understanding. How do you know when to use medication? That is, like I said, it's a very personal choice for each individual, for each child or adult. Basically, it is always an option. So if you say, you know what, I don't want to talk about that right now, it's always an option in a year or in 6 months. That is something that would be prescribed. You would want to go first to your primary, and depending on different things, for example, South Dakota is incredibly rural, so there's areas where the nearest psychiatrist is a 3-hour drive. So sometimes the general practitioner will say, you know what, I did some training, I am comfortable prescribing a stimulant. If not, they would refer to a psychiatrist. If I kind of like to say, if you're asking yourself, do I need to talk about medication? It's worth having a conversation with the prescriber, because you could, after that conversation, still choose not to do it, but just to get more information about your symptoms and your struggles and kind of what's the best treatment plan for you. Can my child have an IEP and a 504 with ADHD? It depends. Every state has different requirements, but my understanding is in the US, all 50 states, that ADHD does qualify for an IEP. If anybody knows of a state that doesn't apply to, please let me know, but I believe it always does. My son was diagnosed with ADHD at 5. He is 11. A couple of years ago, he had another evaluation where they gave him the autism diagnosis, then took it away. Next steps to narrow down the diagnosis. He has sensory needs, low self-esteem, impulsive. So he's now 11. I guess, so depending on how long ago the last evaluation was, it could be valuable to get a second opinion. I can't really speak to, of course, a specific case, but so I don't know why they would give it and then take it unless they were saying that it was initially misdiagnosed. But if he has a therapist that he goes to, talking to them about options for getting a second opinion, getting retested at this point. Suggestions with ADHD and virtual learning difficulties. Yes, not wanting to complete work or study, child is not medicated. Virtual learning has been very challenging, especially for kids with ADHD. There is a lot of times in the classroom, a lot of opportunities for a teacher to cue a child to be, you know, gently just, you know, hey, you know, I noticed that you're having trouble. How can I help you? And when you are doing virtual learning, that all goes away. It's hard because the teacher, again, isn't always seeing that on the computer screen. But if they're, I have spoken to some teachers about to help kind of cue kids that Zoom has for example, a raise your hand option, or there's a like a reaction where you can like give a thumbs up, and only the teacher can see who raised their hand. That it could maybe be like, hey, at some point the teacher's going to say, everybody raise your hand, and everybody who remembers, you know, there's like a reward to kind of reinforce the focus in that way. Also, I think a lot of online learning is we are still figuring out what that needs to look like and how that's going to be effective. So I'm hoping that teachers are going to be continuing to figure out new ways of engaging kids in that way. Can autism be misdiagnosed as OCD? Yes. That kind of the fixated interest, the very specific routines, there is again a lot of overlap there. My child just got testing done for school. They stated he may be on the spectrum for autism, but his communication is not an issue. They wouldn't be able to help him. Okay, so it is possible for communication issues to be due to ADHD, but they're saying if he's showing some symptoms, you could absolutely talk to a psychologist about getting a little bit more testing done. That's something with autism, like I said, that we're still working on getting the best, you know, most clear diagnoses that that every person with autism presents differently. So sometimes there's, oh, you know, that like he's communicating just fine, but he's not showing these other things. So it could be good to get a little bit more testing to get a little bit more clarity there. Often if a child doesn't already have a therapist who can give a recommendation for testing, if you talk to their pediatrician, they will have someone that they refer to for that. What if we went through an assessment, they named it ADHD, and when as parents we know for sure there is autism, should we go for another assessment? Been taking meds for 2 years, no difference. Counselors think it's autism. You can absolutely get a second opinion, especially if it's been a while. There's always the option for retesting. I like to say when I do an assessment, I'm typically pretty confident in my diagnosis, but I don't want to say that it's impossible for me to make a mistake. It does happen. So it's always within your rights to get a second opinion. Thoughts on medical marijuana for ADHD or CBD? I will be honest, this is a topic of interest for me that I need to do some more learning about. It was actually just last week that we decided in South Dakota that we're going to start allowing medical marijuana. So a week ago, I would have said, well, it's not legal here at this point. And now I will say I am planning to do some reading on that. Anecdotally, I've heard some things, but I would need to look at the research a little bit more. At what age is it common to see biggest signs of ADHD within a child who's diagnosed with autism? It really depends. Like I said, you can do these assessments from a very young age, but it just depends on the child. Some kids if autism is maybe masking some of the ADHD symptoms, you might not notice them right away. Not that it develops later, but that if something is masking something else, it's just not manifesting in that way, if that makes sense. Suggestions on how to deal with a 9-year-old who is starting to be aggressive, possibly because of puberty. I think that aggression is always something you want to be careful about, because we don't want people, we don't want kids, you know, hurting themselves, hurting someone else, juvenile detention interfering. But definitely I would say talk to therapists, get them in that therapy to kind of address what's triggering some of the aggression, talk a bit about if the possibility of medication to help with some of that self-regulating. Sensory processing, can this be associated to children who do not want to sleep in their room and only feel safe sleeping with parents? It is possible. That can also be related to anxiety or trauma, but it can be if you're very sensitive, for example, to sound. Any little noise can be more disturbing when you're trying to sleep, things like that. What about trauma and its impact on brain mirroring symptoms of ADHD and autism? I want to know more if there's a correlation. Yes. So there is some overlap also with trauma and ADHD and trauma and autism. So that's part of why we do the testing, kind of, for example, a lot of kids with trauma history are very hyperactive. So that's why we want to do the assessment to kind of figure out what's going on. Another thing that we have been learning about trauma is that kids with neurodevelopmental differences are at higher risk for traumatic events than neurotypical kids, whether it's that kind of perceptual difference, that they're maybe more socially isolated, so that a predator might pick up on that, whether it's that someone who doesn't understand how to meet their specific needs is maybe disciplining in a way that's traumatic for that child. Not that trauma causes neurodevelopmental differences, but because we don't really approach children like, how can I help this child? What does this child need? A lot of times we'll interpret behavior as, you're being defiant, you're being naughty, I need to punish you. There is the higher rate of the trauma from that. I hope that made sense. Can ADHD have a speech delay? Yes. Not automatically, but yes, it is possible. Ideas for a 7-year-old that loves video games to get social would be helpful to get together with a buddy who also loves games. I would prefer to get him away from games. He isn't interested in anything else. The great thing about video games is that a lot of kids like them, even neurotypical kids. And actually, in the time of COVID, you can, depending on what system you have, you can play with someone without them coming over. So it's definitely a way, and I get not wanting your kid to be on the system 14 hours a day. Screen, oh my goodness, that would be a whole other presentation. We talk about screen addiction, we talk about screen time, what's the appropriate amount, what's the balance there. But that's a hard balance too, because we also don't want to completely shut down a child's interests. Rejection sensitivity disorder is a problem with children and adults with ADHD. Can this be more extreme in a child who has autism? Yes. So rejection sensitivity disorder is not in the DSM-5 at this point, but it is something we've talked about, that rejection sensitivity as a symptom of ADHD, with, again, that impulse control, kind of immediately going to the worst possible situation. And actually, it can be a symptom with autism, regardless of whether there's comorbid ADHD, which is one of the reasons why sometimes an autistic adult will get misdiagnosed as having borderline personality traits, because of that rejection sensitivity. At what age should medication for ADHD be considered? Well, there's not a set line. Like I said, medication is very personal choice. And it depends on the family, it depends on the child, it depends on the severity of the symptoms that you're seeing. It depends on, is the child completely unable to learn anything at school because they're so dysregulated? Is the child getting incredibly aggressive? So basically, these kinds of, looking at all of these questions for the individual. I think I mentioned this before, but basically, if you're wondering, is it time to consider medication? It's worth having a conversation about it to figure out what is the best fit for you. Oh, something disappeared. Sorry. I think someone asked about the slides. I think we can make those available. I mean, that's fine with me. A child with severe anger outbursts. Yes. So both ADHD and autism can come with those anger outbursts. There's that emotional dysregulation. So if appropriate, medication combined with the therapy interventions, helping learn better choices, behavior interventions, things like that. Is it more common to see ADHD in a child whose parents have ADHD? Yes, there is a genetic component there. Not 100%, we don't completely understand genetics, but yes, if there's a family history, it is more likely. If you have children with autism and ADHD, should the parents receive testing? Like I said, there's a genetic component, so it could be worth looking into it. If you notice something, then you might want to then you might want to see, you know, what else might be going on there. A 20-year-old woman who was diagnosed with both ADHD and autism, previously known as Asperger's, advice as to what techniques or strategies could be helpful from being so scattered. I struggle to maintain drive. Okay. I would say a good starting point would be if you're not receiving therapy services at this point, that the ongoing therapy kind of services to help to figure out, to kind of, it sounds like there's a lot going on, so even figuring out prioritizing which things kind of need to come first and kind of what supports would be best at that point. So that ongoing therapy services, I would say, would be a good starting point. Most important points or questions to ask a parent or guardian during an intake when you know the child has ADHD or autism. Well, I do like to know if they're already diagnosed. I do want to know information about if they have a copy of the report. I want to kind of know who did the assessment, what measures they used. That can give you a lot of good information about that history, family history, and then just the specific concerns that they're having right now. Diagnosis is, I mean, we do, as part of the intake, come to a diagnosis, but as far as formulating the treatment plan component of the intake, it's less about the diagnosis and more about kind of what goals does this individual have. Difference between Asperger's and autism as far as behaviors go. They're now under that same umbrella of autism spectrum. And part of that reason was that we really couldn't justify that there was a significant difference. What did you say is the cause of a child acting like a zombie? Oh, some parents who are considering medication are concerned that medication will like zombie out the child. And I was saying, if you notice that, it means that you're either on the wrong dose or the wrong med. And medication management is very complicated and nuanced, and it can take some trial and error of, okay, what's the right amount? And I was just saying, if that's a concern that you have, or if that's something that you notice, you definitely want to speak to the physician right away about making a change to the medication regimen. It's just a sign that it's not the right fit. My child never had extensive testing, just Vanderbilt was sufficient enough. Is that okay? Yes. So it depends on who is doing the testing, what their protocol is for that. When I, at my full-time practice, when I test for autism, if the client or the parents are open to it, I do like to do a broad screening in addition to the ADHD testing to get more of that information, because there are a lot of comorbidities with ADHD. However, if you're just saying we need ADHD, or we just want to know yes or no ADHD, the Vanderbilt could be enough if the provider's comfortable making a diagnosis based on that. 4-year-old constantly chews on clothes, blanket, whatever he can get his hands on. I suspect sensory processing disorder. Is there a test for that? There's not a specific, that I know of, a sensory processing disorder test. However, because some of that falls under the umbrella of autism, some of those autism assessments can look at those sensory processing kind of issues. I would say, again, pediatrician's a good starting point for that. Does autism get worse over time? Say you were diagnosed high on the spectrum, can you decline as you get older? So this again is the issue with that kind of the levels of functioning that we use for diagnoses now, that a lot of things can affect functioning. And this isn't specific to autism. This is every single person living in 2020, I think, can think of an example of how stress can cause their functioning to take a hit in one area or another. So not necessarily that it gets worse, but there is something called autistic burnout. And that refers, it was previously called regression, but it's now referred to as autistic burnout. And it refers to basically the stress of being overstimulated or of being forced to mask in a lot of different situations can cause that, basically your mind and body saying, okay, this is not sustainable, we can't do this anymore. Tips to get my daughter to sleep through the night. She has ADHD. I could do a whole other presentation on sleep hygiene too. One thing that I try to do for a lot of the kids that I work with is getting what we call a bedtime ritual, basically having a very calming routine that's about 30 minutes before bed, and it's very, routine, exactly the same every time. And that starts to train your brain with, okay, when I brush my teeth, and then I do this, and then I do this, that means it's time to feel restful. That means it's time to go to sleep. Avoiding any activities that kind of bring up your heart rate, things like that. If you're able to cut off screen time in the afternoon, because the screen does make our brains think that it's daytime, or at least using the blue light filter to help with that. I have an ADHD 15-year-old that is struggling with hybrid school model, goes to school 2 days, does from home the other 3. Suggestions for lack of structure. Sure. So one of the challenges, I don't think I said this yet, one of the challenges with online schooling is that in-person school creates a certain amount of structure that you then have to create for yourself at home. So as much as possible, creating that structure at home, coming up with what routine works for him with his learning style, things like that, to be able to help him have, again, that as much like a classroom sort of experience at home when he's not able to be going to school. ADD support groups that parents can be a part of to help us understand or help our children. I don't know of any specifically off the top of my head, but there might be specific groups in your area that are for parents to help with understanding their kids. I think that can definitely be beneficial, and maybe with this rise of telehealth, because I know one of the issues that I run into anytime I try to start a group in Sioux Falls, South Dakota, is not enough people meeting the criteria for what I want the group to be for, or I don't want to go to that group because my neighbor might be there. So with the telehealth, hopefully we can get some more groups going. I don't know of any specific ones I can recommend, but they can absolutely be helpful. Again, if one is in your area, doctor or pediatrician should have that information. Have you seen behaviors or diagnosis of other disorders such as OCD with autism or ADHD? Yes. So there are, I've kind of referenced that there are more comorbidities. I think back in October, ADHD Online did have someone speaking on anxiety and ADHD having overlap. I believe it's something like 85% of people with ADHD have another diagnosis as well of some kind, with that 25% autism, and then, other things too. What are some ideas or things that can be done to avoid medications? So that is, again, medication is a very, very case-by-case personal choice. For some people, it's not something that they're wanting to discuss, and it's never you have to or you can't. But I would say if they're not already seeing a therapist, getting them in with a therapist, if you can find someone who specifically specializes in ADHD and autism, to help with specific supports in that individual case. How successful are non-medication therapy interventions for treatment of ADHD? They can be very, very successful. Again, it's very individualized, but for some, like I said, I've seen some do really well without medication. I've seen some do really well with medication, and some who will be on medication for a while and then go off of it and then be doing much better. Are ASD and ADHD diagnosis sufficient to qualify for an IEP? Yes. So the school, it depends on the state again, but the school will do their own evaluation, but they will test for those things, and they will often accept a diagnosis. I would say you want to call the school specifically and say, what are your specific requirements? Suggestions for parents with a 3-year-old that is acting out in preschool think he may have autism. You can test for autism at age 3. So if you are suspecting that, I would certainly talk to the pediatrician about getting a referral. Can ADHD come with ODD or DMDD? Yes. I have to double check on DMDD, but I believe that you can. I know disruptive mood dysregulation disorder can't be diagnosed with oppositional defiant disorder, but I believe it can with ADHD. And I know that ADHD and ODD can be comorbid. How common are comorbidities such as OCD and anxiety with autism and ADHD? CBT therapy effective for this? CBT therapy is, yes, effective with autism, ADHD, anxiety, OCD, and combination of comorbidities. 85% of people with ADHD have a comorbid diagnosis. I don't have the exact number for autism, but there is that it would be quite high. Does the Revibe watch work? I'm sorry, I don't know what that is. So I would have to say I don't know. What type of professional do you recommend for the psychosocial part of treatment? So as far, oh my goodness, the list from insurance company is overwhelming. So as far as the psychotherapy component, I mean, I am a psychologist, but treatment outcomes show that more important than the specific credentials is that fit. I would say you would want to see who on that list maybe specializes in the diagnoses that you're looking at. And it is possible to go to someone and just say, you know what, this person is not the right therapist for me. I would say, I think you said your child is 15, talking to them about, do you prefer seeing a woman or a man? What are you looking for in a therapist? And kind of, most therapists have some type of website or Psychology Today profile to give you a little bit more information on their specialties, what their approach, things like that. Can ADHD be confused with an anxiety disorder? Yes, there is overlap, and there is some comorbidity there. So you can have one, the other, or both, and they can both, any combination there can cause inattention and can cause restlessness, hyperactivity. Curious if there is a certificate of attendance. I don't know. That would be, Claudia, do you know the answer to that?
No, not from our end. No, we apologize for that. Yeah.
Can you provide examples of masking that might manifest in an adult woman, and how to identify if we're masking? Sure. So masking refers basically to hiding a symptom so that basically not wanting other people to notice that. And that can look like someone maybe forcing themselves to stay in social situations that are uncomfortable, overcompensating, kind of that white knuckling through the snowstorm. I would say it's very, again, nuanced and can be kind of hard to tell. But if it's kind of like, masking is kind of like you're putting on a show. So if you're feeling like I need to compensate or I'm not really being myself, it's kind of that more masking area. How to support an elementary child with ADD at home. Do you mean like online learning, I believe? So again, kind of having that structure, well, both with online learning and not, having routines and structure and things like that, and helping if you're really children down to a really young age, if you ask them, they will have input. So if you can give them that choice of, what do we want the routine to look like? What's the best way that we can support you? Kind of what do we need this? And if you're noticing, for example, people with ADHD lose things a lot. So say your child will put something down and they have no idea where it is. If you notice that they tend to put it in the same spot, make that the spot that it goes in. ADHD brain will sometimes have its own system that doesn't really make sense, but that person knows where everything is. So, you know, trying to say, okay, is this working for them, even if it looks a little bit strange? Is it possible for symptoms to manifest in adolescence after puberty? Yes. So neurodevelopmental does mean that the difference started very young, but it means that if you're masking, or if there's also an anxiety disorder, things like that, that it can look like it's not there, and then you hit a certain point where you're not able to mask or compensate anymore. Do you see a problem with them playing video games most of the day? Yes. It's a very difficult line. What is the right amount of screen time? And honestly, I want to do a little bit more research on this myself. But it's not, I can't imagine that it's great for anyone to be on a screen, you know, 12, 14 hours a day. So finding that balance, maybe finding ways to engage that interest with the, you know, with the gaming system turned off. I know there's maybe, you know, there's maybe books, or there's maybe groups to talk about the video game, you know, clubs, things like that. My son was diagnosed at 3, and at the age of 11, a developmental pediatrician recommended retesting because he didn't exhibit the same behavior. So it could be worth retesting to see, because again, it is possible for someone to be misdiagnosed. So it could be worth retesting at that point, or even to just see if it's manifesting differently. If they have ODD along with ADHD. So ODD, oppositional defiant disorder, is an impulse control disorder. It's similar to ADHD. ODD is basically someone having the impulse control issue of, I don't want to do what you're asking me to do. And the big thing with ODD is, once the child has said, I'm not doing it, it's the hill they're going to die on. And they are not going to bend, and they are not going to back down. So it's very difficult to, if you lean into that power struggle, then it's just going to be going back and forth, and the child's not going to give up. And then if you have backed down, then you've taught them, if I keep pushing back, I can get you to do what I want. One thing that is helpful with ODD is avoiding that power struggle altogether by giving a choice, kind of a superficial choice. So, you know, I need my child to brush their teeth and put their pajamas on. So I say, hey, what are we going to do? Are we going to brush our teeth and then put our pajamas on, or are we going to put our pajamas on and brush our teeth? I'm not telling them they must do something. So it's not a command that they're wanting to push back against, but whatever they choose, they're going to do the tasks that I need them to do. And then also, when you are getting that pushback, to kind of focus on that emotion behind it of, okay, you're having a hard time right now. How do we get past this without necessarily dropping the expectation? It can be very frustrating because adults, we lean into power struggles a lot. It's very difficult to avoid them. Is it an ADHD autistic tendency to express auditory processing issues, needing someone to repeat them? Yes. So auditory processing disorder, similar to sensory processing disorder, again, not in the DSM, but has that overlap of just, as I'm hearing it, it's not going from here to here. It's not quite connecting right. So maybe I need you to repeat yourself, say it more slowly. Can you write it down so I can read it? Things like that. 9-year-old diagnosed with ADHD, ASD, very high functioning, high anxiety. Treatment. What are the treatment options? There is, with ADHD and anxiety, there are medication options to talk to the physician about. I would recommend looking at a therapist who specializes kind of in that combination to help them with that. Correlation with methadone infants and future diagnosis of autism or ADHD. I don't actually know. So I do know that methadone, being someone who is trying to remain in their recovery for substance use while pregnant, I do know that there is a correlation for substance abuse and ADHD. So it is possible that that genetic component kind of makes that correlation there. I would say I don't know enough specifically about the methadone use to see if there's a connection. How do we change impulsive behavior and not knowing personal space? So impulse control is this frontal lobe right up here, and it finishes developing at age 28. So under the best of circumstances, kids have not learned how to regulate their impulses completely. It can be helpful to be very deliberately and cueing them and reminding them and remembering as the adult, they're not trying necessarily to make a problem right now. They're acting on an impulse. I like to tell a story. I had a client make something out of clay and leave it in my office to dry. My next client saw it and said, "Oh, that's cool." And I said, "Yes, but it's very fragile. Let's not touch it." And the child said, "Okay, I won't touch it," as they were reaching for it. And I just looked at them. I said, "What are you doing right now?" And they said, "Oh," and like put their hand down. They just, the impulse was, "I want to touch it." And they did not realize that they were acting on the impulse. So that gentle kind of cueing can help learn that. Wondering if there was a misdiagnosis of ADHD plus oppositional defiant disorder, possibility of anger outbursts in a young girl due to autism. It is possible. Like I've said, it's always an option to get a second opinion, always an option to get retested. Do you feel the genetic test for medications is accurate? This is another thing that I think we're still working on. It's really cool science, I will say. I think they are still developing the technology to help it be a little bit more helpful. I'm in therapy and I've been consistent with psychiatry and medication all year. I've been in therapy all my life. Do you have any advice other than that? With just this amount of information, I wouldn't be able to speak to a specific case, is what I would say. But I can see it being frustrating if it sounds like you're concerned about the amount of progress made. I would see if talking to the therapist and saying, you know, is there something else you recommend? What can we change? You know, what do we need to increase frequency? Do we need to change something? Kind of see what would be more helpful. If you try an ADHD medication and decide it isn't for you, does it have permanent or long-lasting side effects? No, typically no. Medication for ADHD has a pretty short time in your system. There is some research with kids on stimulants with growth and with weight gain. So that's just something that's why you want it to be monitored by the pediatrician, by a psychiatrist, and they kind of say, this is what you need, basically. Are there specialists who focus on trichotillomania hair pulling, or do they generalize it as OCD? Nobody has been able to help other than meds haven't helped. Okay. So hair pulling, trichotillomania, I believe is categorized in the same part of the DSM as OCD, but it is possible for someone to specialize more specifically in trichotillomania. That would be something, again, you know, professionals on their websites, things like that, seeing if they specify that they specialize in that. Suggest for an adult who oral stims who struggles with overeating. So something that can help for sensory issues is occupational therapy. So that could be something to talk to either your therapist or your physician about if it would be an appropriate referral. Can someone become immune to ADHD meds? Not to my understanding. Are they more effective if you take breaks, such as not taking on the weekends? Medication breaks, or I think they call them like medication vacations. It depends on the individual. It's an option, which again, it's not right for everybody, but it is right for some people. So it just depends on the case. Have you seen a child with ADHD or autism have difficulty with sexualized behavior? So I would say more often sexualized behavior can come from that that reenacting the traumatic experience. But ADHD and autism can definitely affect, because of that impulse control and that boundaries. I would say with that trauma history, wanting to be working with a therapist who specifically has that trauma training. Suggestions: working with parents of a client with both diagnoses who do not actively try to enforce routine. Client is homeschooled. They do not have a routine for school either. I would stress to the parents the importance of creating that routine, and why that routine would be so helpful, and kind of even specifically, here are, you describe such and such behavior, here's how a routine could help with that, things like that. My son is 10 and autistic ADHD. Since the pandemic hit, he refuses to leave the house, meltdowns, so we never go anywhere. It's been months. Tips to get him back to where he was before, being okay with leaving again. It has been a stressful year, and kids have gotten hit with it very hard too. A lot of us, like I am doing my practice telehealth at this time, but if he's working with someone, if he's refusing to leave the house, there's a possibility that he could start that treatment without having to get to the office. So that is something that that could be beneficial. Can an employer legally fire a worker if their symptoms of ADHD or autism affect their job and they already have a diagnosis? I can't speak to legality. I don't have the legal training for that. My understanding would be that there is some protection for that under the Americans with Disabilities Act, but would definitely need to talk to a lawyer for more information. I read that children with autism have poor gut health. Is that true? And if so, why would that be? We have found a connection, but have not really found out a why there, just that there are differences in gut health. So my not super helpful answer is yes, and we're not sure why at this point. Does DBT therapy help ADHD and or autism? It can. DBT can help with, there's a lot of that mindfulness components to that. So, so that can help with that slowing down and that impulse control, that regulation. When I'm in a group and we are meeting for a specific purpose, example, running a group where I know a topic to talk about, I am overly outgoing compared to in other situations. How do I know if this is masking or special interest that gets me excited? If I'm meeting the same group, a purely social situation, I'll be quiet and awkward. That would be something to explore with kind of ongoing therapy to see. It could be that special interest if you're finding that you really enjoy talking about that topic and that kind of brings you up, versus if it's kind of draining you in that sense. Kind of a can be a good kind of determinant, get a little more information about that. How do you not take things personally when they attack you physically and emotionally as a parent? I am assuming you don't mean that the parents are like coming at you and trying to hit you. That is not an experience I have dealt with. If a parent took a swing at me, our office's policy is I would call law enforcement, but not taking it personally when they emotionally come at me. I'm just remembering, it's kind of the same way I don't take it personally when kids yell at me, that it's not really about me. It's about their frustration with what's going on. We say about kids, it's not that they're giving me a hard time, it's that they're having a hard time. So just understanding, okay, this is a very hard time for you. But also with parents, if they are being, vulgar and emotionally abusive to me, I will set that boundary for myself and I'll say, we can continue this conversation. I have had parents curse me out and I have said, we will talk later when you're not talking to me that way. Help with a child who talks nonstop, mostly fictional ideas, hard time with fantasy and reality, sure. So that My Mouth is a Volcano book that I mentioned earlier does help with that kind of continuous talking and things like that. But also kind of a social skills component, maybe a social skills group or something like that. Usually therapists have information about groups that they can recommend. 15-year-old son diagnosed with ADHD at 8, requesting an evaluation for autism. Do you think speech therapy would help him? He started using very extensive vocabulary. That would be probably a part of the evaluation that you do, kind of seeing if he qualifies for speech or if that would benefit. The best treatments for autism, that again really varies because treatment plans are so individualized, and it would depend on the individual specific areas of concern. Are they really wanting to build social skills? Are they really anxious about different things like that? The biggest thing with the treatment plan is again that individual need. So that was the last open question. Oh, I just saw in the chat, make a call when you stop the Q&A. I guess now, because we got through all the questions, thank you everyone for being here, and I hope that this was valuable, and I hope that we can make the slides available. People can access them if they need to. Yeah,